Welcome to the ARH Health Education Series. Today we are talking about the new drug therapy that is out to treat COVID-19.
The new drug is called Bamlanivimab. It's a monoclonal antibody that's specific for the treatment of COVID-19. And so, and it's what we call a monoclonal antibody. So it actually prevents the virus from infecting cells. So it's an infusion therapy, so you get it through an IV infusion. It's only indicated for patients that are not hospitalized patients, which is different than what we've normally seen in remdesivir and other therapies for hospitalized patients.
Okay, so what is the goal of this therapy?
The goal of this therapy, if I might jump in, is to prevent disease progression.
Okay.
As Jeff said, this is a monoclonal antibody that latch onto the virus, trying to prevent the virus from attaching to the cell and entering the cell. So the goal is to prevent the disease from progressing. And eventually we have to give it the sooner the better. Our goal is to prevent the patients from getting sick enough to go to the ER or getting sick enough to get admitted. Again, this is not a cure. This is a monoclonal antibody that's supposed to slow the progression of the disease.
Okay, so who can get this? If I have COVID symptoms, can I just go to the hospital and say, hey, I want this new drug?
No, we have criteria that we establish with pharmacy, and we have a team that put the criteria for these medications. We want to give it to the patient who are at the highest risk of progression of the disease. And the criteria are, patients who are more than 65 years of age, who has been diagnosed within, 10 days of symptoms. That means, they have to have a test that's positive, but it has to be within 10 days. And then we have to, they can be patient above the age of 55 with, chronic medical condition like heart disease and hypertension and even lung disease. And then anybody above the age of 12 with morbid obesity, a BMI more than 35, chronic kidney disease, diabetes, or immunosuppressive drugs, on medication that suppresses your immunity, or immunocompromised with a low immune system.
Okay.
And so, and just to add to that too, so when the FDA authorized the use of this drug in hospitals, basically, as Dr. Carter said, the purpose of the drug is to keep patients from progressing the disease. And so it is only indicated for infusion for patients who are not eligible to be admitted. And so you would only give this drug for patients who are sick, who are showing symptoms of COVID, but are not sick enough to be admitted. So if they're requiring, oxygen or are on oxygen and require higher doses of oxygen, they would not be eligible. Those patients would need to be admitted. And so it's given through an outpatient infusion. And so patients, and as you mentioned, Heather, when patients present to their provider, that provider would contact the hospital to actually schedule the drug. It's not an emergent drug. We want to give it when possible, but it's not an emergent drug. It doesn't have to be given immediately. So that the provider would schedule the administration of the drug with the facility, let the patient know when they would come back to receive the medication, and then they would come in. They would have about an hour worth of infusion, about an hour wait time, about 30 minutes to prep the drug. So probably at least about 3 hours total that the patient would be there to be prepped, to receive the drug and be able to.
So that is a significant amount of time, but if it's going to keep me out of the hospital, then that's time well spent, right? Okay. Absolutely. So you answered my question, who can't have it? So if you're in the hospital, or if you're, if you need oxygen therapy, then you don't need this drug, right?
Or if 10 days or more have elapsed since your diagnosis.
Okay. That's good information to know. So where and how does somebody get this? You mentioned that it's your doctor who gives you the order for it and who then gets it scheduled. So if I have that doctor's orders, what are my next steps?
Well, just to clarify, so if Dr. Carter was seeing a patient in his clinic and he said this patient is eligible to receive this drug based on the eligibility criteria, then he would contact the hospital, would schedule the patient for an infusion, and then they would give him, the time when the patient should come and go, obviously go through the process. Each hospital has a particular process in place how patients will be brought in, because obviously these are positive COVID patients. Mm-hmm. And so in a particular location where the medication will be given. And so it's a very regimented process to keep the patient safe and keep the healthcare providers safe as well. So, and to really maximize the efficacy of the drug.
And when you say infusion, you're basically talking about an IV, like an IV drip, right?
That's correct.
And are there any risks? Is there like a wait time? Do I have to like sit there and make sure that I don't have some type of a reaction?
Yeah, we monitor the patient for 1 hour after the infusion.
All right.
We do have a protocol in place if a reaction has to happen. The studies have showed that if a reaction has to happen, it's usually minimal and usually very easily managed by medication we give.
So there are some side effects, but in your experience and from the literature, there's not a whole lot of side effects. Is that right?
Yes, from the literature, there have not been any side effects. And from my limited experience so far, has not been very much side effects. Maybe none.
So has this drug therapy been given in our area? What's your experience with that?
We actually, go ahead.
Go ahead, Jeff.
No, I was just going to say, I mean, as of today, we've actually given 3 doses in Whitesburg, a dose in Hazard, a dose in Morgan County, and a dose in Tug Valley. So we're starting to see, patients get this therapy because it is an important therapy to, as Dr. Carter said, to decrease the potential or the severity of the disease to keep them, out of the hospital. And Dr. Carter has been was actually our first prescriber of this therapy for patients.
So what's your experience, Dr. Carter?
Well, my experience has been great so far. You always want to remember your first infusion and your first trial of the medications. It was a 36-year-old male who woke up the evening before he presented to the clinic. We did a telehealth visit with him, sick with fever, chills, nausea, headache, sore throat, and eventually he was tested positive for COVID-19 by a nose swab, a PCR test, and his risk factor were his BMI was more than 35. And all the studies have showed that they have a very high risk of progression of the disease. Actually, obesity is higher risk for severe COVID-19, higher than age. And so far we said age is the highest risk factor, but obesity goes along with that and maybe more. So we decided based on criteria that he would qualify for the infusion, and he received the infusion the next day. And it was, we followed the protocol that Jeff talked about. We called the hospital. They provided him a room where it's safety for him and others, and he received the infusion. And the next day I called him and his symptoms were improved by 50%. And then I called him back again on Monday because he got the infusion on a Thursday and the symptoms were improved by 90%. He was almost back to normal.
Wow. That's a great success story.
Yeah. And again, the studies showed that the medicine work, but how do they work if given within the indication and within the specific guidelines we just talked about?
Right. Well, I thank you both. This has been great information, very useful. It's wonderful to know that we have this new therapy that helps people recover and not be hospitalized. So thank you, Jeff Akers. Thank you, Dr. Cotter.
You're welcome.
You're welcome.